Hello and welcome to A Deeper Dive with me, Dara Kam. Today we're taking a deep dive into the treatment of gender dysphoria with Yale School of Medicine Assistant Professor Meredithe McNamara. Dr. McNamara specializes in adolescent medicine. She's interested in implementing best practices in the care of youth facing complex trauma and high-risk social situations. Dr. McNamara cares for youths ages 11 through 35. We'll take a deep dive into the state's efforts to block gender-affirming treatment for youth.
The Florida Medical Board is looking to propose their own standards of healthcare within the state of Florida, which is something that I have never heard of before.
You're listening to A Deeper Dive with Dara, a podcast by City and State, Florida.
Hello and welcome to A Deeper Dive with Dara Kam. Today we have Yale School of Medicine Professor Meredithe McNamara, Assistant Professor of Pediatrics and specializes in adolescent medicine. We're going to be talking about transgender treatment today. So thank you very much for joining us, Dr. McNamara.
Oh, thank you so much for having me.
So the state has taken, is Governor Ron DeSantis, the Department of Health, and now the Board of Medicine, the Agency for Healthcare Administration, so many different arms of the state are addressing transgender treatment for youth and adults in a variety of ways. The Agency for Healthcare Administration is considering a rule that will stop reimbursements. The state Medicaid plan will stop reimbursements for gender-affirming care for youth and adults. The Board of Medicine is moving forward with a rule that would prohibit doctors from, I want to say, prescribing a gender-affirming care for adolescents. So maybe you can correct me on the correct terminology to use, and I apologize if I floundered
No, it's
there.
okay. So it's really complicated. I think, there's been a lot of legal actions to limit or ban gender-affirming care in various states. We've seen different flavors of them. We've seen kind of like the legal opinion in Texas that says, based on pre-existing law and how child abuse is determined in the state, we say gender-affirming care is the same. So that was kind of like one type of thing, a legal opinion, not a new law, but an interpretation of existing law that supposedly criminalized gender-affirming care. In Alabama, also in Arkansas, although both of these laws have immediately kind of been enjoined by the courts, those laws had kind of just been blanket laws passed by state legislatures that said, gender-affirming care is illegal for these ages, and these are the punishments that we would levy against those who provide it and parents who consent to it. So that's a new law. Florida is doing a lot of really weird things.
Welcome to the Sunshine State, Doctor.
I know. I just want to tell your listeners, I'm not a Floridian, but
that's why we have the hashtag Florida Man. Yeah. So what are we doing? That's weird.
So I'm like I said, I'm not an expert in Florida politics, but this kind of like weird patching together of a bunch of different regulations and rules and movements is probably because it would not fly to pass a law that denies gender-affirming care. That Florida is too purple. And what we've seen are some, albeit like kind of creative, but very strange, sneaky, and also unprecedented legislative actions to try to limit transgender people's access to healthcare.
Wait, let me step in right there, if you don't mind, because I
Yeah.
don't think that Florida is too purple to pass a law banning gender-affirming care. And that is because Republicans have a lockdown on both the House and the Senate in the state legislature. And we did pass, either last year or the year before, a law banning transgender athletes in high school and collegiate sports. So I'm not sure that we wouldn't pass a law. I think one of the reasons for them moving forward in the way that they are, and this is maybe a little just wonky, but the legislature doesn't come back again into session until January, and so they can move forward with these things on the agency rule level without having to wait.
That very well may be part of it. I am not an expert in, Florida legal procedure
Right,
at all.
right.
But these bans, though, these healthcare bans, it's not really something that people just support along party lines, because there's a lot of argument over whether or not it's okay to interfere in the parent-child relationship. And that is very much like an anti-conservative thing, that extreme type of interference.
Just saying
Even
government, less government intrusion.
Right.
And yeah, I get that.
This isn't, the healthcare bans are special. They're different. And they're much more complicated than just limiting
Sure.
youth social engagement. Like in Arkansas, for instance, a very conservative governor vetoed the state's law banning gender-affirming care because he felt like it went way too far. It was too intrusive. And that law does not currently stand because it was immediately brought to court via lawsuit, and it's since been enjoined. But these are the types of conversations and types of legislation that we're dealing with now, that it may be even too conservative for conservative politicians. All that being said, I think it would be kind of like the cleaner approach to try to pass a law. But what's happening in Florida right now is, I kind of see it as twofold. First of all, trying to ban or end Medicaid coverage for Floridians who are on state insurance of any gender-affirming treatments. That is not a ban on physicians' ability to prescribe gender-affirming medications, but they're not going to receive any reimbursement for it. All of this medication is going to be out of pocket.
Which is going to be probably, if you're on Medicaid, you're impoverished to begin with. And so the notion that these folks could pay for these medications or treatments or doctor visits on their own seems pretty far-fetched.
Right. It would amount to tens of thousands of dollars a year of out-of-pocket treatments. And so that's kind of one thing. That's the proposed Medicaid rule. What's coming, I did know that this was probably going to happen, although it's very strange to see it unfold in real time. The other thing that's happening is that the Florida Medical Board has undergone a lot of rotation in its members recently, and some very conservative people with true ties to anti-trans organizations are now on that board. The Florida Medical Board is looking to propose their own standards of healthcare within the state of Florida, which is something that I have never heard of before. So standards of healthcare don't come from states, don't come from governments. They come from clinical research that gets reviewed and vetted and discussed in relevant groups of experts and published and spread widely and adopted by people everywhere. These clinical guidelines, standards of practice are universal. So the fact that the Florida Medical Board is deciding that they know more about gender-affirming care and medical aspects of it than anyone else in the United States, and that they would rewrite the clinical practice guidelines, is unheard of.
As a physician yourself, that must have a chilling effect, that you think that because the Board of Medicine is taking up a recommendation or proposal from the Florida Department of Health. The Florida Department of Health's proposal is very similar to and rooted in the report that the Department of Health's recommendations is based on the report that was done by the Agency for Healthcare Administration regarding the ending of reimbursements for gender affirming care for trans folks who are on Medicaid. So there's a
Right.
lot of overlap there in what the board is doing and the state departments are doing. And they're, many of them are, I think that they're rooted in, now there was this 1,000 something page document that accompanied the Board of Medicine's proposed rule. And it looked like a lot of the same research that was cited in the ACA report. But as a physician, you're saying it's just, this is not something, boards just don't change, develop or adopt their own standards outside of what is known as, what's the term, generally accepted standards, or
Yeah.
those are issued by the areas of specialty, right?
Exactly. This is kind of reminiscent of when our former president hired or appointed a neuroradiologist, I believe, or something along those lines, to head up the coronavirus response.
Right.
It's this really kind of like concerning lack of expertise in areas where healthcare decisions are being made. Kind of like willful ignorance to that.
So it's based on, you said you're not a political science professor, but I do write a lot about politics, and so it is it's more of a culture war issue, but they're using science to justify their actions. And you and I spoke recently, and you were calling what the review or you didn't call it junk science, but you said that it's science denialism. And I was wondering if you could maybe talk about science denialism in the area of treatment of gender dysphoria.
Sure. Well, I think science denialism has been a really useful tool to those who want to ban sound, solid, established healthcare. You can kind of cherry pick data, pick one line from a study and ignore the rest of it, propagate outright falsehoods, falsely portray the standard of care, and generate a lot of kind of fear among the public, and just barrel forward with an anti-science policy. So, it's kind of like an example. Florida's stance is that there is not sufficient evidence to support the use of gender-affirming care, that it doesn't work, it doesn't treat gender dysphoria. But what they do is they go through this really kind of like contradictory series of justifications for that statement. Number one, they'll say, well, gender dysphoria is actually a mental health condition and people just need therapy for that. So that's false. Gender dysphoria is not a mental health condition. It's been declassified by every major medical society. It's not pathologized anymore. That really does evoke the same sort of pathologizing that was really harmful to gay and lesbian people, and kind of labeled their sexual identity as a disease.
Stick around. We'll be right back with Dr. Meredithe McNamara, Yale School of Medicine professor who specializes in adolescent medicine.
Here at Deeper Dive, we want to hear from you, the listeners. We invite you to send your questions, comments, and feedback to our mailbag. You can reach us at deeperdive@cityandstatefl.com. That's deeperdive@cityandstatefl.com. Get your 2 cents in by sending us an email.
Welcome back to A Deeper Dive with Dara. So can I ask you about that? Because I was having this debate this morning, actually, about some of the argument is that this is a thing now where it's trendy. I've talked to a lot of folks who've said that this is a thing now, that it's trendy for among teenagers, preteen, teenagers, to either believe they're gay, or this is not me saying this, to be gay, to come out as gay, or to express desire to want to change their gender identity. So how do we talk about that if it's not a disease? I'm stumbling around trying to use the correct terminology, and I'm probably getting it all wrong.
Well, it's important to make a couple distinctions first. Sexual preferences and gender identity are completely different concepts. They cannot be conflated. I just kind of brought up the sexual identity example because we're seeing parallels, kind of like the same sort of pathologizing that was really dangerous to the gay and lesbian community is like that language and rhetoric we're hearing now. Just give these people therapy, change their minds. And that's a really dangerous line of rhetoric, because it assumes that there's something wrong with them, that they have an illness. But if we can pathologize them, then we can discriminate against them in really dangerous ways. So that's kind of why I use that example. But
I think it's a fair example, because I do, and I also think that even in the debate that folks are having, and I'm not just talking about just me and my friends, but political leaders are conflating both of those things when they talk about youth. Right now, that's what they're doing. They're lumping them all together.
Right. That's a problem. That is kind of an old problem that I think youth have been dealing with for some time. But what you did bring up before, which is another argument that Florida has kind of sunk their teeth into, is this idea of social contagion.
Right.
This idea that a transgender or gender expansive identity is contagious, that it can spread within social networks, and that it's something that's influenceable. So we're kind of back there again at pathologizing, right? Because if it's something that you can catch, so to speak, then it's a problem. It's a disease. It's a phenomenon. That is dangerous rhetoric. It's also just not true. We can kind of look at the logical arguments, but then we can look at the actual data, which does not back up the fact that social contagion is not at play here. So a couple of points to that. First of all, modeling has been done, like statistical modeling, to look at the number of transgender and gender expansive identifying people who've disclosed their identities in national surveys. Social contagion would, if it was actually at play, led to much higher numbers of these youth identifying as such over the past couple of years than we're seeing right now. So that theory just doesn't line up. Second of all, the data that was literally just out this week showed that less youth over the past couple of years have actually been identifying as transgender. We literally just got this week. It's a study in pediatrics by Jack Turbin and his people out of UCSF. It's an analysis of the CDC's Youth Behavioral Risk Survey data, which is just an annual blanket survey for all teenagers.
Yes.
So that's kind of more information that debunks social contagion.
I think we need to talk about that for a moment, because people are believing that it's trendy, that it's a growing phenomenon among adolescents.
Let me just say this. I don't really, as a physician, as somebody who cares for youth, I don't engage with kind of like the ideology, like the negative ideologies that they face that are kind of like limiting and make them feel unsafe in today's climate. I don't engage ideologically. I engage with science and facts. The science and the facts just don't back this up. And I feel like that's kind of the end of the story. If
Okay.
people still want to dig their heels in and insist that gender identity is contagious, then that's willful ignorance to the science. And even more so, the more concerning thing is that ideology is dangerous, and it provides the same sort of excuse or cover for discrimination and violence against a marginalized community.
A marginalized community that already is highly at risk
Right.
for marginalization and violence and suicide, right?
Exactly. It makes the climate that they live in even less safe, even less welcoming when it's already so hard. But I want to circle back to what the state is doing, because it's
Yes.
one thing for this conversation to be happening in social media forums and between parents groups and that kind of thing. It's not healthy or productive or safe in those areas, but for the state to take that ideology and claim that it's real and then base healthcare policy on it is really unprecedented. I don't know of any other time when we've really been dealing with this, except maybe like some of the really early discriminatory laws against Black people in this country regarding, like basically institutionalizing slavery.
Huh.
So this is why this is so scary. It's that the state has picked up this mantle. And the state of Florida has undertaken one of the most sophisticated and detailed and yet incredibly flawed defenses of social contagion, for instance, to justify banning essential health care. They have pulled a bunch of very flawed studies. They have cited non-peer-reviewed literature. They have solicited the testimony from people who have ties to anti-trans organizations, whose testimony has been thrown out of court in other legal proceedings, all to say that transgender identity isn't real, that it's something that you can catch from your peers, that it's something that can go away with the right kind of therapy. And all of that stuff really takes those harms. It really basically puts fuel on the fire of the minority stress that the trans and gender expansive community is experiencing right now.
Well, I am surprised to know. So Florida then is an outlier. You're saying that there are no other states' medical boards doing what Florida's doing?
Not as of now, I think. I don't know what conversations are being held behind closed doors, but this is scary stuff, because what kind of precedent does this set?
Right.
And when
Where
if the
does it
Florida
end?
Medical Board can be successful in this effort, then what else can they be successful in? And what sort of precedent does that set for other aspects of essential health care?
That's a really interesting question. And I think I mentioned to you before we started rolling that recently, I'm laughing because I'm always mixed up with my dates here, that the governor recently said that he thinks that doctors should be sued for providing gender-affirming treatment to adolescents. And I thought that was a very shocking statement for him to say that.
Yeah, I mean, it's a very odd statement. It's very irresponsible. I'm sure he does think that, but that is also kind of like blowing smoke. It really doesn't have any teeth. And one thing that we are seeing in the legal fights to protect essential healthcare for trans people is that there are checks and balances on the power of the state, of politicians, and that he can say whatever he wants, but that's not a directive to sue your doctors. And more so, I don't know of any families with transgender or gender expansive children who are looking to sue their physicians for providing this essential health care.
I think enough said about that statement of the governor's, but I wanted to ask you, how common are puberty blockers and surgery for youth and for adolescents? I would imagine that surgical interventions would be pretty rare. So, but the puberty blockers and hormone therapies, how common are they? How common is it?
I don't know if we have actual data on I mean, if we do, I'm sorry, I don't know it off the top of my head. The decision to start medical care, meaning medications, is very much individualized. So puberty blockers are used in early puberty to kind of just pause physical change. The data on puberty blockers shows that there's adequate identical catch-up growth, meaning like if you had kind of like height stalling for a few years from the ages of maybe like 13 to 15, that you'll catch up. But it allows families to buy time to kind of think a little bit more. A lot of gender dysphoria emerges in early adolescence. It presents outwardly then. And puberty blockers can let families kind of like talk and get to know each other, and it can allow the adolescent to receive some counseling and support. The decision to transition to hormones does not happen for every youth who identifies as transgender. They get an extensive, prolonged, informed consent conversation that happens over the course of several visits, and it's about them considering their physical goals and trying to line that up with the medical treatment.
I just want to jump in there for a moment because I think that the state's position, or one of the things that I read in the state's report, is that when you look at it, that because there are so many youth who do not move on from puberty blockers to hormone replacement, that means that it's just a phase and that they detransition, and that that they shouldn't be allowed to go on to hormone replacement because they sort of self-select out.
I'm not even sure how the state found data on that. I'm not sure it actually exists.
Okay.
The decision to, well, they do make a lot to do about the so-called desisters.
Oh, right, desisters. I was calling it detransition, but right, it's desisters. Right.
It's kind of a harmful term. I don't like using it because it kind of.
Yes, I'm going to say this, and you correct me if I'm wrong. It implies that there's something that you're engaging in some deleterious or aberrant behavior, and you're somehow able to prevent yourself from going down that, reefer madness road, or whatever the equivalent is for gender affirming or gender transitioning. Okay.
So choosing to stop medical care, stop a puberty blocker and hormone treatment, and to kind of assume the physical characteristics of the sex assigned at birth. There's been a lot of studies into that group of people. A lot of those people actually found that the social climate that they were living in was just far too unwelcoming, and it was harsh, and it created a lot of distress, which is heartbreaking that people might choose to not live as their authentic selves because that is too unsafe and unwelcoming.
Which shows you that how hard it is. So when people talk about this being a cool thing, or kids wanting to do this because it's cool or it's trendy, I mean, I have personal members of my family who have transitioned. And I mean, it is not easy. It is very hard. It's very hard and very complicated and very messy.
Right. And it's hardest for people who are not Caucasian. It's hardest for Black and Latinx Americans, and I mean, the rates of murder among Black trans women are atrocious and devastating to consider. Um, and the other thing, though, that I just wanted to say about um, the, those who maybe do not choose to use hormones after going on puberty blockers. So there is that criticizing that and saying that that is an indication that maybe gender dysphoria isn't real is kind of, it's concerning because it kind of sticks to that binary idea of gender.
Hmm.
You know, you're either you either identify as male, as female, or a trans male or a trans female, but you know, what about non-binary people and people in between, people who don't identify as either? So that is that sort of rhetoric and that argument from the state also just kind of neglects to pay attention to this whole other group of people who have a non-binary gender identity.
So then if you can't talk about this in school and you can't,
Yeah.
we don't want to talk about it anymore,
Yeah.
you have to keep it a secret, you're also giving them the message that there's something bad or wrong about
Mm-hmm.
who you are,
Mm-hmm.
that othering.
Yeah, and I'm an adolescent medicine physician,
Right.
so I care about adolescent cognitive development so deeply. And I know that youth can really thrive and achieve their full potential during this developmentally complicated and exciting period of their lives when they're in a safe, welcoming environment. And the exact opposite happens in these types of environments you're discussing or describing in schools where you can't talk about who you are, you can't speak openly, you can't be yourself, you can't express yourself, that's dangerous. That rewires adolescent brains in a way that is really hard to undo in adulthood. It basically encodes the trauma for life.
Hmm. That's interesting, and that might be part of why we're hearing more. There might be the impression that there are more gender fluid folks around now. It's just that they never had permission to express who they really were
Yeah, I mean,
until quite recently.
gender fluidity has been around since the beginning of time. This shouldn't be new. What is fairly new over the past couple hundred years is this kind of binary male versus female cisgendered social construct, and that has driven a lot of gender expansive identifying people underground because it's just simply not safe.
Hmm.
Over the past decade or so, it has felt more welcoming. You have visible transgender people. And I think one thing that we've also discussed before is that legal protections for other groups of people, like, for instance, marriage equality in the gay lesbian community, has had a very positive impact on youth well-being. We
Yeah.
knew that after marriage equality was passed, suicide rates among LGBTQ teens, lumping that whole group together, dropped significantly. No other factor responsible when you look at a very detailed statistical analysis. So it's not surprising that more people are comfortable expressing their identities, or at least have been,
Because they feel safe to do so.
because they have felt safe to do
Right.
so.
Right.
And it's devastating to consider that we would be moving backwards as a society.
Right. Well, thank you so much, Dr. Meredithe McNamara. Is there anything else that we didn't touch on that you'd like to add?
I would just encourage your listeners to pay close attention to how things unfold in the next couple of weeks. One thing that we can take heart in is that the public comments from the national community, Floridians, in the with the medical board and with the HCA have been robust and strong. And those comments are in the public record. The state either has to respond to them or will face consequences for not doing so. So I do want people to take heart. I think anyone who is in the trans community who is listening to this today, I would also just kind of send a message of solidarity and say that we see you from all over the country and the world, and that we're doing everything we can to protect you.
Thank you so much. Meredithe McNamara, Yale professor of medicine, specializes in adolescent medicine. Thanks a lot for joining us on A Deeper Dive today.
Thanks a lot, Dara.
A Deeper Dive with Dara is a podcast by City and State Florida, hosted by Dara Kam, produced by Ryan Daly, and music for the podcast was recorded by Periodic Labs, LLC, and performed by Ryan Daly and Danny Reyes.